So there was a point where the doctors actually came into the room and said to my parents that he's not getting better, he's not responding to the medication, so we might have to do surgery, or you're going to have to look at surgery or cutting a part of his colon, his large intestine out because, he's not getting better. And my parents were like, how is this possible? Like, he's been under your care for the last like 4 or 5 weeks. No one really knows a disease until they have it. Like I don't know like how doctors do what they do because they don't know what it's like to have IBD. They don't know what it's like to, go to the toilet 40 times a day, yet they're prescribing things and doing things and saying certain things that don't make any sense, and the poor patient is suffering. And I mean, they're just doing what they've been told, it's just what you learn in medical school. And unfortunately, what they're learning is, initiated by Big Pharma and initiated from, the way that the system was designed with the Rockefeller, because they're not interested in actually finding the cure or whatever. They want to just keep people sick, and that's why we see people on medications for life, because it's a symptom relief. It's a temporary solution. It never really goes away. Disease doesn't go away with medicine. Medicine cannot cure anything. That's why they say it's an incurable disease with medicine. And so we had to find a way out, and we're so happy that we did, because what we do now. And
Helping to
anyway, so the gastro said, the senior gastro then came to me and goes, I think it was a lady, and she said, right, if you're not going to take any medication, then get out. Get out of my hospital. So I said, fine, I'll get out. And yeah, that was the last time I stepped foot in a hospital. And that was
was what, 12 years ago?
yeah, yeah. And I'm so grateful for knowing what I know, and also just that drive to become better. Kind of, the doctor actually helped me do that, because I'm like, I'm going to prove this lady wrong. Because my mum actually said to me one day, she's like, do you want to live or do you want to die? And um, so it was definitely a wake-up call when she said those things. And I realized that, when it's just like, animals in nature, when they're backed into a corner, they come out fighting, right? So that was my attitude towards this condition. I was like, I ain't going back to hospital. Uh, and actually, I did go back to hospital. It's very easy to get short-term results. And, you know, I mean, whenever you don't really understand what health truly is, you'll get sucked into all these things. And people do. People get so sucked in because there's people talking about it. And I feel like there's a little bit of trickery going on there, where someone's getting paid to say something, and the associations, the affiliations, if you follow the money, you'll find the truth. It's almost like a duty, right? If you know something, you need to speak about it, and that's why we started Hike Up Health. We started our YouTube channel so that people could start to, or how we could bring awareness to people out there that didn't have any idea about this condition, especially back in 2014. No one was talking about diet or lifestyle. This guy was talking about it. Well, he had books, right?
Hello, everyone. Welcome back to Health Alliance Australia's podcast. My name is Jeannie Rose Angewartha, and today we have Shamiz Kachwalla, who is an incredible testimony of how he healed from severe ulcerative colitis, which is a chronic, potentially life-threatening inflammatory bowel disease without surgery and drugs. He lives a full and active life, even doing full marathons, and is a certified holistic health and natural healing counsellor, along with his brother. They have helped hundreds of people reclaim their health and lives using a nutritional and lifestyle approach to health. Thank you for coming today, Shamiz. I got to know your brother and his wife in 2022, and he shared with me your story. I also met your mum and your dad. So it's great to finally meet you. I don't think I've ever seen a whole family as committed to health. And I remember asking your brother a question about, why that was. And the very serious look came over his face, and he said, because my brother almost died. And his words have always stuck with me in my own health journey recovering from heart failure. So I'm really honored to meet you here today, that you can share your story with many others. Can you please take us back to when you were first hospitalized and how you were diagnosed? I mean, did you have any indication that there was anything wrong with you?
Yeah, well, thanks for having me. It's amazing to be on this platform and share my story with your audience because I believe we have the same outlook and perspective in life that we want to help people and share our suffering and turn that how we turn that suffering into happiness and joy and health. So yeah, thanks for having me, and it's I can't wait to share what we have to share. So how was how did it all start
Mm,
with me? I guess yeah. It didn't feel like I was that sick when I first went into hospital. When I first started to see symptoms, yeah, it was unusual, obviously. I started seeing like blood in my stool, and I started to go to the toilet more often, and there was a bit of pain in my stomach, and I was kind of like, what's going on here? I should get it checked. And so, I did that. So I went to my local GP, and this was obviously in Japan, out of all places, as I was teaching English back in 2012. Um, and so yeah, I walked to the local GP that was there. I think he was the English speaking doctor there at the time. And I said, hey, these are my symptoms. What should I do? And he basically said, all right, we'll just get you checked just, in case, because I can't do anything right now to tell you, what's wrong with you. It's better if you go into hospital and do some more severe tests or more testing. Um, and so, yeah, I then scooted to hospital the next day, and they basically kept me there for 1 week for observation. They did a sigmoidoscopy to check what was going on. So I described my symptoms to the gastro that was there, and he said, "All right." Well, he actually did something very uncomfortable. He basically stuck his finger up my bum
mm,
and then took it out and just wanted to see what was coming out, and he's like, "Oh yeah, you've got some blood in your rectum. We're going to do a sigmoidoscopy," and that was yeah very uncomfortable at the time. I was like, "What's going on? Like, don't do that."
yeah,
Um,
wow.
and then, so obviously, they diagnosed me after the sigmoidoscopy with a mild case of colitis. And colitis is basically inflammatory bowel. So your gut has inflammation, and it was, yeah, just a mild case. So more where the rectum is, the rectum area. And, they said, oh, we'll keep you here for a week and um, see how you go. And, you should be out of here by then. And obviously that wasn't the case. And, I had some pretty terrible times in hospital and yeah, it was not, as I thought it would be. And obviously the doctor's saying that, you'll be okay and things like that. And so I was like, ah, sweet, no problem. I should be out of here soon. But yeah, obviously that wasn't the case. Yeah.
So your mum, she flew across, didn't she, to be with you?
Yeah, so obviously, my parents actually did have to come to hospital after I think it was 3 weeks because my condition just got worse and worse and worse. So they obviously put me on the standard medications for colitis and Crohn's disease, 5-ASA or mesalazine or pentasa, as they call it. It's an anti-inflammatory drug that they give to all patients. I also was on a that's sort of like a rectal foam as well, so an enema. I had to do an enema in hospital, and that was very uncomfortable. Um, thank God I don't have to do that anymore. It's just horrifying to think that you have to stick something up your bum to uh, I don't know, do what? I don't know, but they
Yeah.
say that it works, putting some liquid up there that, calms down the inflammation or whatever, but didn't do that for me. So eventually, my bowel health worsened and I was going, from 3 to 4 times a day to upwards of 10 in the first week. And then they sort of started, you know, thinking that I was something serious here, and they sort of started me on steroids, prednisone. Unfortunately, that didn't do anything either. Um,
Wow.
and I started getting worse and worse and worse, and slowly started to lose weight too. So I had to run to the bathroom, like, yeah, it was just back and forth, going. And I had to walk with that. What's it called, the drip, because they had me
Yeah.
on the drip as well, and so I had to walk with that, go into the toilet, and then well, I couldn't hold my stool either. I couldn't hold my stool, and so I was very incontinent, and it was yeah, it was tough, and I was like, this is bad, like I'm getting worse, and that's when I sort of called my parents and I said, hey, I don't know what's going on here. These doctors also don't really know what's going on because they're saying that my condition is getting worse. This is what I have. I didn't even know what ulcerative colitis was.
Mm.
It's a pretty weird name um,
How old were you at the time?
to Google. 23 years old.
Okay.
Yeah. And, I
Quite
was,
unusual, isn't it, for someone so young to be so sick?
well, yeah, I think I didn't really pay attention to what I was eating. And of course, what we know now, when you look back, you're thinking, okay, well, maybe there was, something to that. And of course, there definitely was a reason why I got sick. But getting like so severe um, while in hospital, that was the thing that I questioned a lot, and why I got so bad in such a short amount of time when my condition wasn't so bad, when I first got diagnosed. So that was the issue for me as well, that I was under the doctor's care, and yet, I was getting to the point that I couldn't even lift my arm up at one point. So that was the biggest issue for me, is that, how did I get worse? I thought medicine was supposed to make you
And did you
better.
get better in hospital? Did you turn it around?
Well, I did, yeah. Obviously, that was the turning point. But the thing was, because all of the sort of middle grade medicines didn't really work, they had to, up the dosage and put me on immunosuppressants. So basically, shut down my immune system. And I was on a drug called tacrolimus. So this is basically, I kind of went a little bit more forward, but I got to a point where I was so bad, I lost like 30 kilos, and I was going upwards of 30 times a day to the toilet. I actually had to get a private room
Mm.
because I couldn't use the public or the gastro wards toilets because it was too far for me to walk. I literally had to jump out of bed and need the toilet straight away. And so we had to get a private room, so bathroom and room, hospital bed. So there was a point where the doctors actually came into the room and said to my parents that he's not getting better, he's not responding to the medication, so we might have to do surgery, or you're going to have to look at surgery or cutting a part of his colon, his large intestine out, because, he's not getting better. And my parents were like, how is this possible? Like, he's been under your care for the last like 4 or 5 weeks. And that's when my mother started searching online, and she was just like frantically like, is there a cure for this? And so because we were in Japan, um, we found this book,
Mm.
which is called Self-Healing Colitis and Crohn's, and the author David Klein, he had the same condition for quite a while, and he found a way out of the system. And of course, it was definitely all about diet and lifestyle changes, and especially when you have a gut condition, like how can it not be diet related? And of course, the gastroenterologists, they don't actually mention that, diet has anything to do with this condition, and it kind of makes you wonder, like, why? Why are they saying that?
Mm.
Because your whole health is based on your guts, your second brain. It's almost everything, um, that makes your body work, digesting food. So we found that book, and my mum was typing in Google, "Is tofu good for you?" So being in Japan, so that book came up, and we were like, "What is this?" So we bought it in hospital. It came within a couple of days from Amazon. We posted it to the hospital, and we were like, "Oh my God, we got a package." And we started reading it, and it started talking about how, the gut is healing when there's inflammation, and like why ulceration, or what is ulceration, what is inflammation. It started talking about this, explaining exactly what the root cause of any kind of disease is, or disease of the body. And so we were kind of shocked, and we were like, this is amazing. And why aren't we told this? Why isn't anyone talking about this, and if there's a way out, then we got to do it, because my mum refused the surgery, thankfully, as well at that time, because she didn't want, her son to be cut open and, live in a bag for the next
Wow, that
three
was that
months.
bad.
Yeah. And the doctor said that I'd already been in hospital for like 5 weeks. So they said you're gonna have to stay in the hospital for a further 2 months if you want to do this procedure. And I was like, no, no, thank you. I've had enough of this. And so that's why we were kind of desperate, and we had hope with this book. Um, so just before we did, the doctors basically told us that I'd need surgery. They also gave us another option, which was that immunosuppressant drug. So I'm going to explain that this drug is very strong. So basically shut down my immune system. So from 30 to 40 times a day, my bowel movements dropped to about 15.
Mm. Were
So
you eating at that time? Were they feeding you?
no, they weren't feeding me actually. They for like I think 3 weeks, I had a catheter in my neck, and they were feeding me with just IV, through my neck here, and that's another funny story as well. But they didn't give me food because they're like, we want to give the medicine a chance to work, and obviously it didn't work in the way that they wanted it to. But because the immunosuppressants basically shut down my body, it couldn't actually do its job. It couldn't heal and
Ah, yes.
do the work. Um, so the bowel movement situation dropped. I started eating food again because they realized that I couldn't just keep doing the intravenous for, that long, that I needed to get some food in me. I was not in a good state. And we somehow, you know, worked out that we wanted to be eating this food, the food that this book was suggesting. And we talked to the dietitian in the hospital, we talked to the hospital, restaurant, or not restaurant, but where they make the food, kitchen. And we actually were allowed to configure our own meals. So basically, we said, look, just give us some steamed vegetables, mashed potatoes and things like that. We'll take care of all the other things. So don't worry about breakfast, lunch. So my mum bought a smoothie maker and a juicer in hospital. So she brought it along, and we started juicing and started drinking smoothies
Yeah.
made from bananas and dates and things like that. And I started eating that stuff. And also during this time, I had a little bit more energy because the bowel movement situation dropped. I was able to actually start to, sit up and do some work, and look online and things like that. So I started and read the book, and I started reading about this medication, tacrolimus, and the side effects from this medications. It said that I won't be allowed to go in the sun, because it affects my body in some way, and like possible chance of skin cancer and things like that. And I'm like an outdoor person. I'm an athlete, like I want to be able to go out and do things without having to worry about that, the sun being an issue for me. It's like, no, that's not what I want. So I started to actually, get rid of this medication. I actually, for some reason, because I got better, I think they started giving me the medicine orally, like instead of giving it to me
Yeah.
intravenous. So they were giving me prednisone through IV. And because I got a little bit better, and also because you're not supposed to take that prednisone for a long period of time, they sort of started giving it to me orally. And that was a big win for me because I'm like, okay, I don't have to take this
Mm.
medication. And obviously the nurse would come, she would give me the medication, stay there and watch me take it. And I wouldn't take it because I'd be
Yeah.
like, oh, I'm too tired, I'll take it later. And so the nurse would go back to doing her thing, and I chucked it. I literally flushed all the things down the toilet because I'm like, I'm not taking any of these medications. And obviously, I started eating better and I started to actually feel better. My bowels started working better as soon as I started eating this food. And obviously, I was pretty malnourished, being 35 kilos in hospital. So when I started to get some food inside of me, my body sort of woke up from like, nearly dying
Mm.
in that way, being 35 kilos. I don't know if you can show some pictures, but
Yeah, we'll put some pictures up when we
yeah, what
edit
I
this.
was.
But
I'll send you
I mean,
some
I've
as
seen
well.
some pictures, and you look really bad. Um, you
Yeah,
know,
so much pain, so much cramping, and it was like hell. It was so bad. I don't know actually how I did it, to be honest. Like when I look back, I don't put that on. Like I don't want anyone to go through what I went through, and I guess that's why I started doing what I do now. But there's so much. Um, like suffering that goes on with this disease, and how people are unaware of certain things, and I was that person as well at once upon a time, and I didn't know what to do, and this book basically saved my life.
and your mum, I mean, like amazing. I mean, I think the family support that you have is second to none, which is, I guess, part of the inspiration for what you and your brother have started in being able to support other people. I think in making this huge transition, it's bad enough being sick, and then watching other people eat whatever stuff they're eating and feeling like you're not being part of that. But to have a whole family, like I remember meeting your mum and dad, and they're like, no, we all eat the same for Shamiz. Just the love there that your parents and your brother have for you is just so beautiful. And I think we were talking about it earlier in that, there's a lot of people in this health space who are pushing, various diets. And, they're paid to these various influencers to say various things. But I actually know that when I was interviewing another doctor, Dr. Richard Fleming, his book is Stop Inflammation Now, which is very similar to exactly what you and your brother have done in this book. And he was saying to me, oh, yes, he knows of various doctors who don't practice what they preach, but they sell these books. But their results also, they get sick, right? But they're not going to tell you what has happened to them. But there's an absolute genuineness about your story here. No one can dispute your pictures, your medical results. You didn't go into this to be an influencer, even though I feel that both of you have influenced other people, but not also helped people heal
Mm.
and their decisions. I know your brother is incredibly passionate about it. So how long did you stay? Like you obviously got better in hospital, enough to be discharged, and then all the doctors probably thought, wonderful, we've cured him with our drugs.
Yeah, well, that's right. I mean, just going to go back to what you said about having the condition, knowing what it's like to be sick, turning my life around and starting to help other people. I think no one really knows a disease until they have it. Like I don't know how, yeah, like how doctors do what they do because they don't know what it's like to have IBD. They don't know what it's like to, go to the toilet 40 times a day, yet they're prescribing things and doing things and saying certain things that don't make any sense, and the poor patient is suffering. And I mean, they're just doing what they've been told, it's just what you learn in medical school. And unfortunately, what they're learning is, initiated by Big Pharma and initiated from, the way that the system was designed with the Rockefellers and all sorts of things going back in the day with the universities getting funded by, these wealthy people, and how the sort of alternative medicine was sort of debunked or told that that this is quackery and all sorts of things like that, and how modern medicine was pushed into the limelight. Basically all about money, isn't it? And that's why we have a system like we do, and it's a very profitable system. It's very hard to fight the system because the system
Mm.
has a lot of money, and money is what talks. Um, but no, I think going back to your question of helping people, I mean, it's almost like a duty, right? If you know something, you need to speak about it, and that's why we started Hike Up Health. We started our YouTube channel so that people could start to, or how we could bring awareness to people out there that didn't have any idea about this condition, especially back in 2014. No one was talking about diet or lifestyle. This guy was talking about it. Well, he had books, right? So,
Mm.
I mean, books, it's hard to tell your story through a book than it is on YouTube, because this platform suddenly has created so much. But, he was talking about this stuff 30 years ago, or more than 30 years ago now. Um, and if it wasn't for that book, then I wouldn't obviously been able to share my story online and create this YouTube channel that we have today. And just being able to share that, create that awareness for people that have been stuck in the same position as I've been, that gone through the system, gone through the drugs, gone through this colonoscopies. I had 4 colonoscopies in hospital, and the last one was the one that they discharged me with, yeah, because I started applying the principles, eating healthy, understanding what disease is, and having hope. And
Mm.
that's why I got discharged from hospital, because my colonoscopy was clear. The fourth colonoscopy was clear. I had, so many ulcers. It went from a mild case to a severe case in the space of 4 to 5 weeks. And I had big ulcers about that big inside of my large intestine, and was completely inflamed and sore and sensitive. And so, yeah, the doctors were very happy with the results, and they sent me home with a massive suitcase full of medications, because they're like, "Oh, you won't get this medicine in New Zealand, and so here's all this these tablets." And we were like, okay, like, sure. And so obviously we didn't want to dispute anything. We didn't want to say that we weren't taking it and things like that. We just wanted to get out of the hospital, because that was like prison for me, right? Like,
Mm.
it's horrible to stay in the hospital bed and you can't really go out anywhere, and you sort of, yeah, it's like a prison. It's a sick care system, isn't it? It's not a healthcare system. So obviously coming out of hospital, fantastic, feeling good. But it didn't end there. Obviously, when I came back to New Zealand, in spite of my parents' support in eating the same foods, doing the juicing and all that kind of stuff, I went back to eating animal products, and I went back to eating normal food because I had a lot of cravings, and it was like 2 months of not eating any kind of animal flesh, and of course we're
Mm.
drawn to it. We have addictions, we have all sorts of things, potential parasites and things like that. So, I went back to eating that food for about a month. I didn't really pay attention to the plant-based diet, to what this book was saying, as much as I should have been. And I thought I was fine, because I was hoo-ha out of hospital, no problems, bowel movements were fine. So I started to incorporate these foods again, and slowly but surely, my body was struggling. Like I didn't see it until after about a month, but yeah, my body was like, "What are you doing? Why are you putting these foods back into you?" And then so the flare up came back. I got sick again, and I pretty much had to do everything again
Wow.
because I got really depressed, and my mental health went downhill. Because I was like, why did this happen to me? Why everyone else can eat meat, everyone else can eat dairy and all these things. Well, why me? So I victimized myself, and that was hard. That was hard. I got very suicidal, I got very depressed. Again, in spite of my parents being there to help me, I didn't see it that way. I victimized myself and I said, you guys can do what you want, I can't do that. Um, So there was a turning point because my mum actually said to me one day, she's like, "Do you want to live or do you want to die?" And that actually, put me in my position. It sort of it allowed me to rethink, my whole situation and start to understand that, this isn't the end and things like that. There's more to life than staying in this mindset. Um, So it was definitely a wake-up call when she said those things, and I realized that, when it's just like, animals in nature, when they're backed into a corner, they come out fighting, right? So that was my attitude towards this condition. I was like, I ain't going back to hospital. Uh, and actually, I did go back to hospital because I was so severely underweight again. Because the whole thing happened again. I went to about the toilet 40 times a day again. In fact, I think I was worse second time around than first time around
Wow.
because of my mental health, um, spiraling downward. So I did go to hospital in New Zealand, and they basically, gave me an IV drip, which I needed because I was so dehydrated, going 40 times a day, just diarrhea, bloody mucus. So went to the hospital, stayed the night there. The gastro comes in the morning and goes, why don't you want to take medicine? Like they start asking me questions, and they're like, what's wrong with you? And I was like, well, look, I've already done this before. I've tried your guys' way, and it didn't work for me. And so that's why I don't want to take medicine. And I don't want to take medicine for the rest of my life. So don't bother giving me anything right now. Just give me the hydration that I need through IV and I'll be fine. And so I actually got better because of that hydration, because of the IV drip, getting those electrolytes in you and also just getting my strength back a little bit. Anyway, so the gastro said, the senior gastro then came to me and goes, I think it was a lady, and she said, right, if you're not going to take any medication, then get out. Get out of my hospital. And so I said, fine, I'll get out. And yeah, that was the last time I stepped foot in a hospital. And that was
That's what, 12 years ago?
yeah. Yeah. And I'm so grateful for knowing what I know. And also just that drive to become better. Kind of the doctor actually helped me do that because I'm like, I'm gonna prove this lady wrong. And not I had that feeling first, and then I sort of let go of it because I'm like, doesn't matter what I do, they're not going to take note of, this healing power that the body has, because they're not interested in actually finding the cure or whatever. They want to just keep people sick, and that's why we see people on medications for life because it's a symptom
Mm.
relief. It's a temporary solution. It never really goes away. Disease doesn't go away with medicine. Medicine cannot cure anything. That's why they say it's an incurable disease with medicine. And so we had to find a way out, and we're so happy that we did because what we do now, and it's
Helping people. And what do you think is the main obstacles for people? Obviously, it's the mindset, yeah, to what they are going to have to give up. And within this space, I hear very similar things. You've probably heard them all before, but I thought we'd go after them. Questions like common questions about where do you get your protein from if you're eating just a plant-based diet? that especially men in particular are very stuck on this particular question. We were discussing it earlier, how there's a real, masculinity is very much tied to eating meat. And
Yeah, I mean, it's the question that, I mean, everyone asks, right? Like, if you're not eating any animal protein, then where are you getting your protein from? It's been so conditioned, it's been almost like ingrained in our brain that we need to eat some kind of flesh to get our protein needs. And I think we look to the animal kingdom for that and go, what does a gorilla eat? Like they're far superior than us strength-wise, and they just eat plants and maybe some fruit, but the majority of their diet is plant-based, and they don't eat another animal's flesh to become strong and big, like that. And obviously, they're a bit more closer than something like an elephant, for example, who's is a herbivore and eats only plants and becomes that big. Um, so you kind of have to wonder, like, where do the animals get their protein from if they're not eating any flesh? And that's the question that I would say to you, or say to others out there, that like, if where do the animals get their protein from if they can, become that big, or whatever? And also, if we're eating protein from an animal, it's secondhand nutrition, because the animal has eaten a specific plant to get its nutrition and its protein needs, and it's using it for itself. And we're somehow going through the animal to get to the plant source, by eating the muscle meat or the muscle. And it's kind of silly to do that, because you're not getting the clean protein that you need. You're actually getting the protein. You need the amino acids from the plants, and the plants create the amino acids, then they, gets converted into protein in our body. So the idea that you need to go to an animal to source your protein is absolutely ridiculous in 2025. If you don't already know that there are so many different sources of protein, and protein is actually not something that we really need. It's, in fact, it's 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 not actually what fuels us. It's carbohydrates that fuel us, and that's, I think, where the problem is, that people fear carbs for some reason, not understanding what a carbohydrate is. It's a nutrient. It's not a food. We think of carbs as food, but it's not. It's a nutrient, like protein and like fat. And when you eat a sweet potato, you're not just getting carbs. When you eat a potato, you're not just getting carbohydrates. You're getting protein and fat as well in that food group, in that food. So we're not actually understanding what a carbohydrate is, and we're not understanding what a protein is. And I think we've been hoodwinked, to think that we have to eat this. And again, there's an agenda behind there for sure when it comes to eating this kind of food, because the more animals we eat, the more sick we get. And it feeds into the system so geniusly. If you think about it, it's genius when they provide guidelines for us to eat. It's not in our best interest, it's in their best interest, because when you get to 70, 80, you're bound to get some kind of heart disease, and then you're going to be, on medications again, and leading up to that, you're probably going to get high cholesterol, so you're going to take, you know, all sorts of things. Cholesterol lowering medication is the most used medication in the world. And so there's a business here, there's a profit being made.
I mean, there's definitely, a ton of research. I think you interviewed Dr. Eccleston, Cadwell Eccleston. I mean, he would be like the grand godfather. He's like 92 or something, plant-based, done it for decades, lots of research to support what he says. But I find it interesting that these last few years in particular, there has been a real anti-plant-based, pro-carnivore, pro-keto diet movement. And certainly you can't, I can't dismiss it when people say, oh, I feel great on it. But I mean, of course, we don't know exactly what great means. But then when you sort of break it down, often they still have various conditions that they're dealing with. So sometimes the online testimonials of what they say by great, often it's things like they'll put out down to like menopausal issues, they'll start blaming other things, but not the diet. And of course, we've all heard, one of the big things was bone broth. And I think before we were talking initially about that, how even myself, even though I'd done plant-based whole foods, recovered from heart failure in 2012, I'd somehow got influenced when I was really sick in 2022 to take bone broth. And I can still remember mentioning something to your brother about, and he's like, I think he gave me one reason. It was something like it was high in lead or something like that. And but afterwards, I did find that it's very high in histamines, and so it kind of just inflames everything, making things worse. But for some reason, people still believe that it heals them. Is there proof that it can heal colitis with bone broth?
I mean, look, there's always going to be temporary solutions for people out there, and I guess that you've got to go back to that genuine, like truthful, honest, um, reason for doing what we do when it comes to promoting health. And there's so many people that sell supplements. There's so many people. I mean, the gut health realm has turned into how much can I sell? You know, it's ridiculous actually. And I think people are so easily swayed when there's an advertisement online on social media saying that, oh, these are my results before and after. But it's the length of time that people aren't aware that that's what they need to focus on. It's the long-term solution that people are not aware of. And this is what I say to a lot of people, that it's very easy to get short-term results. And, I mean, whenever you don't really understand what health truly is, you'll get sucked into all these things. And people do. People get so sucked in because there's people talking about it. And I feel like there's a little bit of trickery going on there where someone's getting paid to say something, and the associations, the affiliations, if you follow the money, you'll find the truth. And that's where people have to sort of really rethink their, the way that they see health, and the motives that are there. And if someone is genuine or not, you can quickly see that nowadays because they're always going to sell something. There's always some kind of price point or something that, and people unfortunately still believe in that stuff and get sucked in by that. But there's a lot of weird stuff going on online, and we've been doing this stuff for the last decade, and we've seen it come and go. There's been so many fad diets. I mean, the Atkins diet was the keto diet, the paleo diet was the Atkins, and it's just, over and over again, you see people go through these cycles, you see the diets come and go, and you're just wondering what's next. And the carnivore diet was something new, that people were trying to promote, that I only eat meat. And obviously there was a to and fro with like veganism coming in and being such a massive influence on people, that a lot of people actually understood that, okay, killing innocent animals is not a good thing. And this is what veganism actually started out to be. It's an ethical standpoint. It's a way of life that you don't use or exploit any other animals, because there's no need for it. You wouldn't do it yourself. You wouldn't kill animals yourself. You wouldn't kill babies to go and eat some bacon. Just doesn't seem right. So there was a massive shift in people's perspectives, I don't know, 2016, 2017, 2018. A lot of people started to figure out that, hey, this is not a good thing to do. And then they started to obviously then look into the health side of things. And then we had all these amazing doctors suggesting that, a plant-based diet would be actually beneficial and, preventative without any extra sort of reason. There was no reason for these people to say what they're saying, because they were doctors. They were doctors coming from their medical system, seeing their patients suffering, and they couldn't do anything about it until they actually started to do the research themselves and started doing clinical trials, Dr. McDougall, Dr. Esselstyn, and you know, those are the kinds of people that you want to be following because they are genuinely trying to help humanity. They're not selling anything. They just got books,
Mm.
and they actually wanting to help people change their lives, and they have done helped so many
Yeah, I
people.
mean, the fact that you don't you don't have supplements additional to what you're eating. Is such a testimony on it. I also wanted to touch on the fats and oils side of things. I think some people do try the plant-based whole food diet and they say it doesn't work for them. And I did come across one of your podcasts where you were saying how people are so toxic initially when they first start, and leads to a certain, I guess, failure rate in people, and then them sort of going, okay, obviously that's not for me, because they've not understood this, I guess, the science of what they're trying to achieve here.
Yeah, I mean, look, if you start eating healthier, you're going to notice that your body reacts differently. You're going to put new fibers in your gut's going to react differently. I think people don't have enough patience these days to actually sit down and understand what their body's actually doing and why. And I think that's the biggest problem is the education around it. It's always, butterflies and rainbows on social media, right? And don't really necessarily, no one talks about the way that your body responds when you eat certain foods. Um, and people just want a quick fix. So they're going to move on from, you know, this way of life. I mean, it's a diet for these kind of people after all. It's not a lifestyle change. And people just want to keep looking for something new always. It's like
Mm.
we're constantly being fed that on TV. People are talking about it, new car, new phone, new burger. Constantly we're being pushed to do something different, change, change, change. And
Yeah.
I think that's where people are so impatient in themselves. And that, again, it's a reflection of society. People just want to, they can't do the same thing over and over again, because they, they are impatient. They want to do something different. And I guess you have to be consistent and you have to understand what that consistency means. And I think people don't have the time these days to actually give it a go, give it a proper go, and that's why they end up saying that it didn't work for me. Or there are some cases where, it's not just about diet. There's trauma involved. There's family issues involved. There's relationship issues involved. And again, the emotional trauma that comes with what's happening in the world today is huge. I mean, and COVID showed us that the
Mm.
isolation, you know, don't go out and see anyone, and that's huge trauma in itself. Where you feel left out, and it's psychological warfare. That's what's going on at the moment, and we don't. You have to see through it. You have to see through it, and if you don't, then you're gonna stay in the trap. You're gonna stay in the system. You're gonna stay in the matrix. You know, the movie basically is talking about what's going on right now,
Yeah.
and no one is really thinking that way. Or hopefully there are people on your podcast thinking that way, but
Yeah.
you've got to take that extra step and be like, what does the government really want from you? And you have to actually figure it out yourself. You can't, there's no one else is going to help you. You have to do it yourself. You have to take the initiative and go, okay, like, what is my environment like? How am I doing things to make myself better? Like all this idea about grass-fed beef and free range and all that kind of stuff. It's just putting what's the saying? It's making it
Putting in
look
front of
pretty.
you.
It's making
Okay.
it look pretty, like
Yeah.
the marketing. Again, you're getting sucked in by the marketing if you think that's some kind of healthier food to eat. It doesn't make difference, like you're not actually the same amount of cholesterol, the same amount of saturated fat in these foods. It doesn't somehow magically disappear when it's
Mm.
grass-fed or free range. And not to mention the vaccinations that the animals are getting as well. RNA vaccinations are in animals, for years now. So if you didn't take the vaccine, then you probably ate the vaccine.
Yeah. I
Yeah.
mean, I think it was Eccleston that was saying that the fats and oils damage the endothelium cells. And that is the reason why a number of these plant-based whole food doctors advocate for it. Because I think what the confusion too is when people talk vegan, lots of things can be vegan, right? You know, Coke can be vegan, McDonald's technically could be vegan,
Yeah.
but what you're advocating is something that is not in a box, essentially, something that's coming from the ground with nutrients that have the plant has absorbed from the earth.
Yeah, whole foods, right? Whole foods and trying to be as, whole food as possible. And of course, an oil is not a whole food, it's a processed food, it's ultra processed. I mean, it's 100% fat. And, when we're looking at obesity these days, do we want to promote fat? I don't think that's probably the way forward. And, calories matter as well. And so when you're potentially saying olive oil, is good for you, I mean, there's so many more calories to that, and therefore you're going to be, overeating potentially, and all sorts of other things. I mean, it doesn't fill you up in the way that, whole food with fiber does. Doesn't have any fiber in it. Oil, it's devoid of nutrients. There's nothing left basically except for fat, and that's where the issue is, that we're not seeing the whole food. Like, what is going to be better than a whole food? It's not going to be olive oil. It's going to be the olive, and I don't see any reason to make food with oil as well. I mean, I don't do no oil 100% because I go out to restaurants and I'm going to eat some kind of oil, but I definitely limit it and do not use it at home, because I know that it damages the endothelium, as Esselstyn says, that you've got the lining that's very important for your arterial health, and we don't want to be losing the blood flow in our bodies. We want to be making sure it increases and stays the same. And if we're gonna eat a processed fat and something like an oil, it's gonna make our blood stick together as well. And so there's another problem with eating an oil that's 100% fat. It just does not make sense. So for us, we definitely wouldn't recommend it as a health food, because there are healthier foods than oil.
Mm. So
So
when you come to planning your own meals or planning those for your clients, how do you go about that? I mean, I think there is this perception that a plant-based vegan diet is very difficult. You have to have some sort of, spreadsheet and figure out where all the calories and all the minerals and everything is going. Is that the case, or you?
no, it's just simple education, I guess. Just make sure you're eating enough food for one. Um, what we specifically do is going to be a little bit different to what the sort of general doctors say about whole food plant-based diet, because we're focusing more on gut health. So we sort of say to people that, look, if your gut is sensitive and sore and inflamed, then don't eat a whole lot of variety, because that's not going to help your gut at all. And don't eat all sorts of raw vegetables, for example, raw salads and things like that, because your gut's not going to be able to digest it very well. It's probably going to irritate more than it's going to help you. So go to the more softer foods, soups and blended foods, so that your gut can actually repair. So we believe, well, if food doesn't heal us. Okay, your body heals itself. That's why fasting is the best way to heal, because the body heals in spite of food. And so we need to understand that the food provides the body with the right conditions to do the healing work, but it doesn't heal the body. It just allows the body to do the work and allows the body to engage in the healing principles, or it doesn't. So food facilitates healing or it creates disease. And so you want to be on a, I think if you're going through any kind of disease or healing, then you want to be eating foods that actually facilitate that instead of, create more problems. Uh,
Mm.
so, oil is not part of a healing food, in our opinion. Yeah.
So, in terms of what you have done, like what is your daily sort of meal? Like, I also actually before that, I was thinking about a number of your clients who have healed. You've not, it's not just ulcerative, it's not just colitis. There's many things that so you've seen being reversed um through this.
Yeah. I mean, we've helped people with diabetes as well. And I mean, it's not just restricted to, irritable bowel disease, inflammatory bowel disease, diverticulitis. And there's quite a few things that, again, the body can engage to heal itself. Um, you know, d Diabetes is not a sugar problem. It's a fat problem, and we want to be insulin sensitive, not insulin resistant, obviously. And you know, a whole food plant-based diet allows insulin sensitivity. Uh, And when you understand again how nutrition works and how the body works, it's much easier. So it's all about education when it comes down to it. And obviously with the meals that I prepare and the things that I do, I learn. I learn how to cook. I learn how to do these things because it was a totally new thing for me. And I was interested in it for one, and I realized that there is actually something to this.
Mm.
And that's what made me look into it further, made me do it more often, and made me eat this specific way. And I've been doing that for the last 13 years. And that's because I know that there's something to it that is going to make me healthy when I'm 70, 80 years old. I mean, you see plant-based eaters that have got to that point and are still, doing so many amazing things,
Mm.
and compare that to, someone that's not doing that, you can see the difference. And I don't want to be sick, when I'm that age, because I've already seen what it's like to be sick. So
Yes.
how do I prevent that from happening again? And how do I stop myself from getting that position? Well, simple, just make sure you don't eat any foods that are going to cause disease. And, fruits and vegetables do not cause disease. There's no, like, there's not, like, how can you prove that? There's
Yeah.
nothing out there that, I mean, in fact, it's just a silly statement to think that plants have toxins in them. And yeah, maybe for bugs and insects, they have those toxins, but not for us. Like, the human body can, eliminate that, whatever toxin that these people are talking about. I mean, there's definitely certain plants that we wouldn't eat, but I think if you're going to compare, the disease rates and what people are eating, like, I don't see the hospitals filled with people that are eating fruit. I see hospitals filled with people that are eating junk food, processed food. And what does that include? It includes meat, dairy, and eggs, because all the
Mm.
junk food has all that stuff in it as well. So again, by making it look pretty by having, grass-fed beef or free-range organic milk or something like that, that doesn't mean that it's better for you. I don't believe so anyway. And I think
Uh,
you've got to be kidding yourself if you think that that food is healthy, because it's the fruits and vegetables that people eat that are actually getting them to a healthy state with all the antioxidants and phytochemicals and things like that. And eat color. We're drawn towards color. We're not drawn towards white or brown or red.
So is gluten worth avoiding in
Well, the way that it's grown these days, I don't think it's the best choice to go towards. I mean, I don't gravitate to gluten. I don't eat it very often. If I do eat it, nothing happens to me. But I'm not. I mean, I think there are healthier choices than gluten. I don't think gluten is a bad thing per se. I think there's far worse foods than gluten. Um, but it's again, there's some marketing there. There's some business opportunities. I mean, I was in New Zealand one day. Yeah, I was in New Zealand one day, and there was a butcher that said gluten-free chicken, and I'm like, well, who are you selling to?
Yeah.
I mean, who knows? There might be gluten in chicken these days, but it's funny how something that doesn't have gluten in it at all is marketed as gluten-free chicken, and you're like, that doesn't that doesn't add up. It's good marketing and probably a good thing because he probably sold a lot more chickens to all the gluten-free people out there.
So was it important for you for it to be organic?
Well, I actually healed without any organic food, which is quite funny. Um, I don't think that organic produce, I mean, it's pretty expensive these days to buy organic, and it shouldn't be. Um, I think if you can afford it, then obviously go for it. But if you can't, it doesn't mean that it's going to be that bad for you. I mean, the body can still heal. The body can still do awesome things. It's just again eliminating the biggest problems, which is the animal protein and animal fat. That's what's causing most of our diseases, not necessarily the pesticides. And I'm not saying the pesticides are good. I think that they are probably not as good, um, not as bad for you, sorry, as the other foods that we eat.
Yeah, I mean, if you're going to eat fruit and it's going to cost you $20, $30 a kilo, but you can get the equivalent, cheaper, obviously, calories and so forth. You'd have to make the trade-off with what you could afford to eat. And it's true. I think running Raw Australia, I don't know if you saw them. There were a couple
Yeah,
that ran
that will probably
365 days. I actually saw them finish. I think it was like
amazing.
20, they finished in 2013. It started 2013. And I remember seeing them finish the run. They did a marathon every single day, and they were doing raw vegan. And that was quite amazing when I met them in person. And inspiring because I was going through a pregnancy after that, after heart failure. And
Mm.
I just was so inspired by what they did. And so they were also discussing the fact that they couldn't always get organic when they were when they were running a
Yeah,
marathon a day. But they noticed a sort of energy difference,
yeah.
but it wasn't obviously enough that they couldn't do a marathon a day.
Right? And that's
Yeah,
that's
I
just
know.
outrageous, isn't it? And you think, where do they get their protein from then, right? Like it's unreal that two people of that age can do something like that. And of course, overcome cancer as well and do that. It just goes to show you how powerful your body and mind can be, and also maintain and give your body what it needs, to fuel it, to do that kind of stuff.
Mm,
I don't see any carnivore people doing that. I don't. I mean, I don't know how a carnivore diet could do a marathon, to be honest. Like, you're just not going to get any glucose for your muscles. Your body has to work so hard to convert that protein into glucose that it's just gonna you're gonna bonk. And I mean,
mm.
you don't see many people, eating avocado smoothies, or what do you see people eating and drinking when they're running and using the glycogen as fuel? And like, it's sugar, it's bananas, it's fruit, it's
Yeah,
gels. You don't see people drinking, I don't know, animal fat blended or something like that. It's just gross.
yeah.
And it just doesn't make any sense to think that you could live off that fuel and run and even exercise and do all those kinds of things.
I mean, I think you
Cardio.
hit on it by the fact that, we are primed to do something different. It's sort of like the latest thing that they're promoting, so they can sell more books, they get more followers, they can promote it, sell more meat and animal products. And then, of course, it often takes about 4 or 5 months, and then all of a sudden the people that were pushing it crash, and they can't take, they can't have carbs anymore, and they just, their bloods and everything that were getting really good results at the start then start falling off the cliff. And then, it's hard, I guess, to admit that you were wrong with it all. I mean, the longevity of it is how long can you stay on a diet for? And where it continuously gives you these results. A friend of mine is also plant-based vegan, and she completed a 100-kilometer run the other day in one day. And it was just like, and she also beat cancer. It's just phenomenal. And we don't see these stories often enough. We see, I find that there's a lot of anti-plant-based stuff online now more than ever. A lot of mockery about how veganism is this new world order psychops. And yet I know myself, I feel 3 times on the plant-based vegan diet. And of course, relapsed because, you're exposed to all of this media, whether you like it or not, and also the culture that's around you. You just start taking a bit of this and taking a bit of that. And it's about surrounding people that can support you in that journey, which I guess is what you and your brother do, which I thought we could just talk about what programs you offer to help people on that journey, because I think it's a very lonely journey. It can be, as you said, it can be depressing because socially you can feel isolated, and it's good to have someone there to be your cheer team, cheerleader.
100%. I couldn't agree with you more there, because when I was going through my illness, I would have loved to have someone there to sort of cheer me on, to tell me like, hey, you're doing all right, keep going. The light is there at the end of the tunnel, and you're not going to stay like this forever. Your body's going to change. The body heals, and just give it time, give it patience, and let your body do the work, and trust your body, trust your God-given body. And yeah, that's one of the reasons why we set this up. That's why we set up High Carb Health, because it allows us to take our experience and spread the word, spread the message, spread our experience, and teach people, right? Educate people, just like how we got educated. We want to pass on the baton, right? And for more people to understand that this way of life works really well, and there's no need to get sucked into all these other things. I mean, you can go to this page called Carnival Cringe on Instagram and maybe some other social media platforms, but basically shows how many people are getting affected by these new diets and carnivore diets especially, and how people are even potentially dying.
Yeah.
And like this is where the biggest problem is that you're following an influencer and suddenly they die. You've been following them for however long, it's like they're gone. Like, what do you do? You know, that's unfortunately what they're creating. Um, and who knows what's going to happen in the next 10 years with all these people promoting all these things. I mean, so many carnivore diet people have backtracked. Oh no, we need to start eating more fruit. It's like, there's people saying that papayas are animal-based foods now. The animal-based diet, right? They call it that. And so papayas and watermelon is now an animal-based food suddenly. And you're like, well, hang on a second. How can you believe someone that's told you in front of your face that this is the best thing you can do for yourself, and then gone, oh, hang on a second, I was actually wrong. You need to include all these other foods in your diet in order for you to be healthy, because it didn't work for me. Even though I wrote a book, or I wrote all these things saying that, I should be eating only this food, and plants are bad for you, fruit is bad for you, it's got too much sugar, all this kind of crap. And so you just you've got to really look at people who are actually wanting to genuinely help you instead of make money, and that's you got to figure it out yourself, to be honest. And
Yeah. So
people will learn.
you have a web program.
Sorry, yeah, I get so passionate about this stuff. So yeah, we have programs. There's when we work with someone, we want to actually put them in a position where they can see long-term results. So we do have programs. We have a monthly subscription that we offer. So there's two options. We are going to be launching something new next month. So look out for that if anyone knows anyone that has colitis or Crohn's. If you have colitis or Crohn's yourself, Yeah, just look out for next month because we're launching something quite interesting, and yeah, it's going to change the game, I think, and people are going to start to realize what true health is because of this. Um, but at the moment, we have subscription-based model where you pay monthly and you get our service. There's a basic package where you get 2 meetings a month, and there's a premium package we get 4 meetings a month, so that's weekly and bi-weekly. And we want to educate, we want to make you understand how your body can actually get rid of this disease for the rest of your life. And you don't have to take medicine for the rest of your life either. And if you start eating the right foods, you can build your gut up, build the foundation for, your future. And this is, what you want to be doing and be focusing on the present, but also, understand that what comes next is going to determine your future. So what you do now is going to determine what happens next. And so if you do the right things now, you're going to prepare yourself to have a good life later on when you see all these other people getting sick around you, you see your parents getting ill and their grandparents, what they unfortunately pass away from, and you start learning about disease and how the body, goes from dis-ease to ease,
Yeah.
and understanding that if you just give your body the right conditions, it can do its job. Like, I mean, you see people break bones. What do you do with a broken bone? You put it in a cast for 8 weeks or more if it needs to, and you watch the body heal. You can see the X-rays. You can see how the joint or the bone is healed. The way that the body recalcifies itself, and it's amazing. And so if the body can do that, why can't it heal other things and at a cellular level at that too? So we teach you how to actually transform your life and transform the way you live, because you don't want to be suffering, you don't want to be taking meds for the rest of your life. It's horrible, and they may work for a short period of time, but then what? What happens when they don't? So don't put yourself in that position where you take all these meds and you're kind of stuck because they stop working. And the doctor's like, oh, you're going to need surgery now. So prevent that from happening by actually understanding how the body works, maybe talking to us and seeing, if you're the right fit for us,
Yeah.
but understanding that prevention is the next best cure.
And you've got lots of information on your website anyway, that when people watching this podcast, they can go there, check it out, do their own research, find out if they want to reach out to have that extra additional support, which I think, for myself coming my own health journey, and when your brother vanished into a different state, it certainly did affect me. I don't think I've actually told him this, that I did relapse after he left, and I do wonder sometimes if there was the effect of not, we were quite a number, there was a few of us who were all eating the similar, so we'd go out to the picnic, and my daughter would make a plant-based whole food dessert, and we'd all share it, and it certainly you didn't feel left out, right? And then it got to the stage, I feel, where when you are standing on your own, it is more difficult to do, and you do need to see it as a long-term change. And now I also feel that once you get to a certain point, you stop craving certain foods, and it's really to get over that point, and then you don't actually want it anymore. Like it's breaking that cycle. And also I feel like some of the things are childhood related, like you remember a food from your childhood, it brings back all of this positive emotion, and you just want to eat it. Not because, and it's not good for you, like whether it's chips or something, you can still remember sitting out there eating chips with your friends, and you just want to go back to that certain memory, even though that's just full of garbage.
Yeah,
And
cravings are real. Yeah, cravings are definitely real. But again, if you see beyond that, it's like 5 minutes of pleasure, you know, and you probably won't feel that good afterwards, when you eat something that's not the best for you. But just remember what you're doing this for, and the purpose, especially if you're sick. You've got to realize what is the most important thing in your life and chase it. Don't stop yourself or sabotage yourself. in getting to that point and realized that life is a lot more than, eating something and getting that pleasure from that. Life is about doing stuff, traveling and enjoying, being disease free, being able to just walk. I know so many people that are not in that position. They can't, they don't have limbs or, so it just makes you think about your life a little bit more in depth and realize that what you actually have is amazing, and then the gratitude that comes from it. Don't take things for granted, and like just allows you to be a little bit more structured, and again, everything that you do now is for your future.
Mm. And you also have lots of patient testimonials on your page as well. So if
Yes,
people think
YouTube,
that
Facebook, yeah, all
if
of it.
people feel as though this is just your particular journey, and this is what I actually have also confronted, is this idea that you probably have heard it before. You might want to speak to this, but people will say there's you probably heard the blood type diet. Certain people are genetically must eat meat, right? Yeah, that's part of their. You would have heard this before, and this plant-based diet doesn't work for everyone because of their genetics.
Again, it sounds kind of funny when you say I can't eat fruits and vegetables. Um, I mean, again, there's so much, there might be something more to it. There's trauma there and there's emotional stuff that's going on that people need to fix. I'm not going to say that diet is going to 100% cure you, because you can't rely on the diet always. You've got to focus on many other things as well as the diet. But
Mm.
a good chunk of the healing does happen when you eat the right foods. And so you kind of have to wonder, what is going on with those people that say that a plant-based diet didn't work for me as well. Um, yeah, I don't think that, that an apple that falls from a tree, or, like eating a potato from the ground or whatever, is that harmful that you'd say that, it causes me issues. I mean, is it the fruit and vegetables fault that is causing your sickness? I mean, I don't know. I
Mm.
don't think so. I think there's more to it than that. Are you, is there some kind of, reaction there that is happening because there's fear involved? I mean, there's so much to it. Fear is the root cause of a lot of diseases actually as well. It's not just, the food that we're eating, but the fear of food too, and not, being able to eat certain things because you're too scared to eat that. And that's part of it too. And so, again, going back to that new thing where people want something new all the time, they see all these other people getting better, and it's like, oh, I need to do what they're doing. It's like the sheep mentality, right?
Mm.
I mean, I think people also like to hear good things about their bad habits too. And so people also don't want to hear the truth all the time. So there's so many aspects to healing that.
Yeah. I mean, I think you're right there too. My dad, he had colitis, and he died with colitis. One of the things that he would say to me is, I need to eat meat, right? And it was very, very difficult. But when I look back on it, it's because he was born just after the war, and there was not a lot of food there. So there was a lot of childhood trauma associated with a sense of lack, and meat meant for him um, certainty.
Hmm.
And as you're saying, we're healing the whole person, and food is one very important aspect of it. And it certainly helps your mental health as well. And it's interesting with you how your mental health changed with your diet. Like, you went from being depressed and suicidal to just this glowing person who's got a real love for life.
It's huge, isn't it? It's huge. And you have to want it. You can't be in a position where you're sort of settling. You have to really want it. And I mean, that's what separates, I guess, successful people, from unsuccessful people. Like, how do they get to that point? How does Usain Bolt run is the fastest man in the world. How does he do it? Because there's certain things that he's doing that other people aren't, and obviously there are genetics involved with him, but look, he needs to still do, a lot of things and get to where he needs to be, you know. I mean, what's that saying where he trained so much just to run like 9 seconds or whatever his whole life or whatever, and people don't have patience, to heal themselves in a month or whatever. I forgot what that saying was, but you just think about the effort that he put in just for like 9.5 seconds or whatever. You know,
Yeah.
it just goes to show that you have to do the work. You have to really put in the hard yards, and um, yeah,
So
it's not
how
easy.
long does it take for people to see results from
Well, it
generally
depends. Yeah,
speaking?
it depends on a lot of things. How much medication someone's taken, how much, what their attitude is like, um, what kind of history do they have, you know, because the person that comes to us earlier that's just been diagnosed is obviously going to see much quicker results than someone that's been taking medicines for 2 or 3 years, because medicine does stay in the body, and the body then has to try and get rid of that at some stage, and that can be through symptoms. So um, generally, we say around 3 months before someone really starts to see good positive changes.
Mm.
Um, and for people that have had the condition for more than 5 years, we generally say to them, like, just stay with us for 6 months and see that long-term effect. And even 6 months is not that long.
Yes,
Um,
not in the whole scheme of things. Are you able
yeah.
to help people who've had surgery?
Yes, we did. Yes, yes. So someone did have, I think he had a ileostomy. So he didn't actually have a colon at all. The small intestine was attached to his rectum, and he went plant-based, and he was actually doing really well. Where he started to, because people that have that ileostomy, their life is not, they don't have a colon, so they don't have a microbiome as much, right? So
Yeah.
they're not digesting food as well, and they're probably getting looser stool because the colon isn't there. But he was actually noticing that his body was processing the food in a really good way, the fiber in a really good way, and he saw benefits. It's a bit harder, obviously, to notice like a drastic change when someone doesn't have their colon. But certainly, you're going to prevent yourself from getting any kind of other infections and things like that when you start eating foods that are actually nourishing. Your small intestine is still working, so you're still going to be absorbing all the good stuff. It's just that you don't have the microbiome as much
Mm.
to go with it. But I mean, yeah, some people do really well with that kind of having a colon, and it's not really too often that we see people with or after surgery because
So, so do you include things like fermented foods or probiotics, or is that not necessary?
um I didn't use any kind of fermented food when I was doing the healing work. I don't know how effective fermented foods actually are. First of all, when you're putting salt inside something, it's going to kill the bacteria. It's antibacterial. So how much of a fermented how much of bacteria are you getting from that sauerkraut or whatever? I don't know. I mean, I think we don't necessarily use it for that purpose as much as it's touted for, I guess. If you include a teaspoon of sauerkraut with your meal, it's not. I don't think it's going to do any harm. I don't think it's going to do any amazing good things either. So, it just depends on if you want to include it. I think it might be more of a mental thing as well.
Mm.
Like I'm taking this fermented food, like my gut's going to do really well, and then again,
Yep.
like I think placebo is pretty big as well when it comes to this kind of stuff. And if you're going to actually really focus on your gut getting better because you're taking this thing, then your gut's going to probably get better in spite
So
of.
probably good for you to do it. If you
Yeah,
really,
exactly,
so you don't
exactly.
really
So
have much salt in your.
we limit salt for sure. I don't like we tend to say like half a teaspoon or that vicinity, 1 teaspoon, half a teaspoon, 3/4 of a teaspoon, just because sodium is not the best for us, especially coming from salt. Uh, it just, I mean, it increases your blood pressure, and actually has been shown to take calcium away from our bone as well. So there's some issues with salt that I guess not everyone's addressing too much. But again, for people that are coming to a plant-based diet, you're not going to suddenly quit salt straight away, and you don't need to. It's just again getting understanding of these things first, or later on, and then making changes, refining. And that's what I'd say to people is that you don't have to go
Yeah.
optimal from day one. You can take your time and just stop eating animals first, stop eating dairy first, and see how your life changes. But work your way to refining and optimizing.
What about water? Are you substituting juices and smoothies for water more, or are you still expecting people to drink a certain amount of water for?
No, we believe hydration is really important, and we drink distilled water. We don't drink tap water for one, and we drink steam distilled water. It's really good for drinking something that is very pure. So it's the purest form of water. It doesn't have any chemicals, doesn't have any minerals. And of course, it's a bit of a touchy subject when it comes to minerals,
Mm.
in water, because a lot of people think you need to get minerals from water. But do you? I don't think so. And that's because we don't really eat rocks. We don't eat like sand. And when it comes to minerals, where spring water, where are the minerals coming from? They're coming from all the rocks and things and soils and it's called hard water for a reason, right? And you see all the residue that's on your shower head, the calcium, the magnesium and stuff. That's going to go inside your body and stay there. Your body doesn't know how to process those minerals. However, the plants do. So plants take that inorganic mineral, which is the rock, obviously the soil and things like that as well, and they turn it into an organic mineral for us to then use and for it to assimilate it within our body. Whereas, the residue, that white stuff that you see, or the rocks, broken down into microscopic fragments, the body doesn't know what to do with that stuff. And even then, if you're drinking water from minerals, there's only trace minerals in water anyway. So why would you be doing that in the first place? Just eat your minerals from the fruits and vegetables that we have. Drink your water that's, in the purest form, like rainwater is the best if you think about it, because it's coming straight from the sky and there's nothing, being, well, I guess the chemtrails these days, but that's why we steam
Yeah.
distill. We
Yes.
have a machine that we steam distill the water, and ideally you want to collect rainwater and then steam distill it. And you should see the amount of junk that's in my distiller. I use tap water, obviously, but you should see the amount of crap that's in there that you just think all this hardened mineral that's coming from the water source, that's going to be stuck inside your body. It doesn't come out.
Mm.
Yeah. So we recommend, around 2 to 3 liters a day on top of the hydrating fruits as well, especially because when you're sick, you need that nourishment, you need the hydration. Your cells need that hydration because they're lacking it from all
Yeah, I found
the
it fascinating that when you were in hospital and they weren't feeding you, that you weren't getting better because you would have been essentially fasting. Um, I would have thought that there would have been some sort of turnaround from simply not having any food and giving your bowels a rest, but you
drug
actually
fasted.
needed
I
to.
drug fasted. So
I
unfortunately, I was still getting drugged up, right? So therefore, my body was trying to get better, right? So when you have diarrhea, your body's actually trying to heal itself. When you get food poisoning, why do you get diarrhea? You get diarrhea because your body's trying to flush all that stuff out of you. And also, like, it's a cleansing process, right? So when I was going to the toilet multiple times a day, my body was trying to heal itself, it's trying to cleanse out. but I was putting toxic poison back inside of it with the medications. So I had to deal with the original problem plus deal with the medications on top of that. So I had to actually heal twice.
Mm.
And so that's why, even though I was fasting, didn't eat anything, I lost a lot of weight, but I was also retoxifying myself with meds. And so that's why I didn't actually get better until I stopped the meds and started nourishing my body in the best way that I could. And that nourishment was actually something that my body probably wanted, after all that poison. That's why I didn't get better by
Yeah, amazing.
eating.
So is there anything else you would like to add to today's podcast? I think we've covered quite a lot, but I might miss something.
Yeah, I mean, I guess just recognize that if you're already awake and if you're, understanding what's going on with society today and how the government works and things like that, and even if you're not aware, that's okay as well. But just make sure that you do your own research. You basically try and fight for yourself and realize that you are the only one that can actually change yourself, and don't rely on other people to change you. And think critically, think for yourself, think what's the most logical thing that you can do, and do your best. And also, live a life without fear as well. Be free. Um, don't succumb to what someone says, even me, like what I'm saying to you, do your research and find out the hard way or the easy way.
Mm.
Like after all, we're here to do one job, and that is to be a kind and compassionate human being and to help other people. It's nothing else that God really asks us to do, really, really, if you think about it. Help people, give, give to others if you have more, and just be a kind human being. That's all you need to really do, and enjoy your life, enjoy
Yeah,
yourself and be happy.
thank you so much. So we're going to put this podcast on, well, I don't think we'll have any trouble getting onto YouTube this time, Rumple, BitChute, on our website, healthallianceaustralia.org, which also has a full list of all the interviews. Our censored interviews are actually only on Rumble and BitChute because they got taken down from YouTube. Highcarbhealth.com is where you can find more information, sign up for programs. There's a recipe book, all sorts of goodies there to do your research, and also lots of other doctors. And that link, if you can follow those links, it also links to various research. Shamil can also be found on, High Carb Health can also be found on YouTube, Facebook, X, and Instagram. In closing, I want to remind viewers to check out our other podcasts, which include world-leading health medical researchers like Professor Garth Nicholson, Dr. Kevin McCann, Professor Robin Cosford, Dr. Richard Fleming, and alternative healing practitioners and testimonies from healing from life-threatening illnesses that have many cases being written off as incurable by the mainstream medical system, and other controversial topics, such as the intentional blood clot cover-up. If you wish to support our work, you can do so by visiting the donate page on healthallianceaustralia.org, and you can join our free mailing list. Please distribute this. We are heavily censored. Email it to your friends and family. Health and Alliance Australia is active on LinkedIn. You can also find me there. You can join us there. Thanks everyone for watching today, and thank you, Shamiz, for your time today.
No worries. Thank you so much for having me.